Welcome everyone to our PEHP Quarterly Wellness Webinar. Today we are so excited to have a special guest with us. Doug Love is here from WCF Insurance, and he is a safety specialist. He has worked in the insurance loss control field for the past 29 years, and he holds a BS degree in electrical engineering technology and has attained the designations of Certified Safety Professional, CSP, and Associate in Risk Management. And his safety background includes working with a broad variety of clients in the Intermountain West, from general industry to construction to healthcare, and he coordinates safety services provided by WCF for the whole state of Utah, 19 of Utah's counties, and the cities of West Valley and Murray. So we'll go ahead and give it over to Doug. Thanks for being here.
Oh, thank you, Jody, and it's good to be with you this afternoon. I'd like to take maybe the next 25 minutes and talk a little bit about office ergonomics. And saying that, whether you have an office and work at home, or you work like here at PEHP, or do a little bit of both like I do, what we're going to talk about today would be applicable to wherever your office is, as far as making sure that that's set up properly. I want to talk, what is ergonomics, first off. We hear that name, really it's the science of work, and bottom line is, ergonomics is the science of fitting the workplace to the worker as opposed to fitting the worker to the workplace. And in many cases that's still the way it is and has been, like old ASOC here in my little Dilbert comic here, work is supposed to hurt. That's how we know you're doing your work is right. Well, in many cases, people do hurt when they're working, and that's what we want to avoid. Good ergonomics, especially office ergonomics and good setups, will help you be more comfortable in your job. And I think as you're more comfortable, you're a happier worker, and certainly if you're happy, you're likely more efficient and effective in what you do. Let's talk a little bit about what I want to cover in the next few minutes here. We're going to cover some common injuries and symptoms of ergonomic-related injuries. We'll talk about risk factors. We'll look at the different types of office equipment out there and what you have and how you should set that up. And then maybe even conducting your own maybe self-evaluation of your own workstation and workplace. To start off with, poor ergonomics typically equals what we call musculoskeletal disorders, and say that fast 3 times, or in short, MSDs. It's a group of injuries and illnesses that affect this musculoskeletal system. So we're talking the joints, the muscles, the tendons, the ligaments, and everything that connects those. And not all MSDs are typically a single diagnosis, and we'll talk about the various contributing factors that might contribute to a diagnosis of an MSD. You know, over the years, MSDs have been referred to, you've probably heard the term like carpal tunnel syndrome. Even back, the late 70s, 80s, 90s, we saw a lot of this carpal tunnel syndrome. That kind of graduated into repetitive motion injuries, just in general muscle strains, and some of these other conditions are all kind of grouped under these MSDs diagnosis of bursitis, tendonitis, epicondylitis, which is tennis elbow, and a number of other factors in here. So these all are termed to be under this MSD diagnosis. Common complaints. Typically, there's, with any kind of strain, there's going to be a little bit of pain involved. Especially with like carpal tunnel syndrome, you'll get tingling and numbness, and typically a weakened strength, grasp, decreased range of motion. If you receive a diagnosis from a doctor, or if you go to a doctor to have him look at maybe some of these conditions, typically they'll do a medical history with you, certainly a physical examination, typically blood work, just to try and determine what exactly is going on with your body and causing some of these complaints. Now, in general, ergonomic risk factors, there's kind of the big three, and this is applicable whether you're working at a keyboard in an office environment or maybe on an assembly line in a manufacturing facility. These big three are the postures that we have, and especially awkward postures. We'll talk about neutral postures and how those can contribute to good ergonomics. It's the frequency and repetition also is the other leg of the big three here. And then the forces involved. If you have just one, maybe an awkward posture, typically we don't have problems. But if you combine all three of these things, then you can get kind of the perfect storm, and then we tend to start to have some of these MSD issues. So let's talk about these three here. I mentioned, so the repetition, force, and posture, kind of the legs of my inside triangle here, and that makes up your environment. But your environment may be not only affected by what you do at work, it's also affected by what you do maybe at home or in your leisure. Hobbies can contribute to MSDs. Maybe you have a second job as well, and they can contribute to problems with these MSDs. Your own physiological and psychological makeup also contribute, and we'll get into this a little bit more in depth, but today I'm going to probably focus more on things that affect MSDs with what you may do at work. But just keep that in mind. There's a lot of legs to this, and it's not just what you do at work that may affect it. So let's talk a little bit about good postures and neutral postures. My little graphic here, you can see we were made, at least our spines here, typically with a kind of a natural S curve to the spine. You've all been taught proper lifting techniques, for example. We've all been taught that if you keep your back straight and lift with your legs, you're much less susceptible to, let's say, a back strain injury when lifting something. Well, the key to that is keeping your back straight. And if we keep that kind of natural S curve to the spine, there is strength in maintaining neutral positions. This is a neutral position here as she's sitting at her work station or standing. If we can maintain that natural curve, again, there is strength in doing so. For example, natural neutral position for a wrist. This is an example here with a neutral handshake position is a neutral position for the wrist. I'm grabbing hold of a water bottle here, and as I grip that water bottle and then extend my wrist to the outside, what we call extension, or flexion as I extend my wrist inside. If you do this, and you might just try this at home or at work, wherever you're at, if you had something to grab onto, you'll notice as you extend or flex that wrist that there is loss of strength trying to work in those positions as opposed to bringing it back to that neutral position. And so in our workplaces, working in those awkward postures can irritate or strain the joint, the bone, the ligament and tendons. And if you tend to work in those positions for very long and maintain a static position, you will tend to fatigue a lot quicker. So that's why it's important to know and maintain good neutral positions and postures, whatever you're doing. Now, we're talking a little bit about office environment. And so I apologize for this graphic. I probably should blow this up a little bit bigger, but you can see if you're at a workstation where you're doing sit to stand, our neutral positions there are an elbow at, say, a 90 to 100 degree with your upper body there. Your wrist, and again, a neutral position, flat with the keyboard. Your monitor about an arm's length away from your eyes, and adjusted to a height where your eyes look about the top row of the characters on the screen. That's a good neutral position. Certainly feet on the floor, knees slightly bent. if you're working in like I say, a sit-to-stand station. If you're sitting, then again, we want that neutral 90 to 100 degree angle at the elbow. We want the wrists straight, parallel with the keyboard there, parallel with the floor. You want your knees, again, about the same as your elbows, 90 to 100 degrees. You want your feet flat on the floor, and again, your eyes looking at the monitor about level with the top row of characters on your screen. Now, these are good neutral positions, sitting straight in your back with your chair, the lumbar support supporting your low back there. These are the kind of positions that we're after for the most part. And you can see the little wording at the bottom of that graphic, though. Sitting ideally can cause pain, even sitting in neutral positions for a while, because we're maintaining a static position. You still want to move around, and we'll talk about that a little bit more in depth. But even if you get out of neutral positions and maybe slump forward for a little bit or turn to your side or something just to break the monotony of the position so you're not staying static, is still a good thing. But in general, we like to achieve and maintain these neutral positions at our workstations. So awkward posture, just some example here, whether you're hunching over like in the middle to the left there. Sometimes I find people who have workstations they're set up kind of on a corner of the desk, and they tend to work maybe on the flat part and then look over at the screen, so they're craning their neck a little bit, reaching for things, whether that's your mouse or your phone. Again, these are postures that especially if we maintain them or do them quite frequently throughout the day, are going to cause fatigue. So we'll talk about maybe these postures and trying to make neutral, turn these awkward postures into neutral. Just again, some examples here, just with sitting. This young lady here at the left here, extended with a little bit forward reach, can cause a little bit of stress on the neck and shoulder blades, if again maintaining this for a period of time. The middle picture there, just bending forward. A lot of times this occurs when our feet aren't flat on the floor, or maybe we try and put our feet maybe on the pedestals to get support, the pedestals of the chair. It tends to maybe cause us to lean forward a little bit. But doing that puts abnormal pressure on the low back, and so you'll start to fatigue at your low back if you maintain a position like this very long. And then lastly is the last one here. Her chair is just adjusted a little bit too low, and so you can kind of see she's shrugged forward a little bit with her arms extended, and again try and reach the mouse and the keyboard. And so if we were trying to set this person up ergonomically a little bit better, we'd probably raise the chair and pull that keyboard and mouse back toward the edge of the surface there, and try to maintain again those good neutral angles at the elbow. So common causes of some of these awkward positions, so to speak, the monitor too far away or too high or too low, feet that don't touch the floor, or the desk surface itself too high or too low, and a lot of times we don't have the adjustability with that, and so we'll have to get around that with making other adjustments. And we'll talk about that. Not enough room under the desk, or the armrest is get in the way is very common. So we'll talk about these things. Just in general, I wanted to take a minute and talk about the way you arrange your workstation here. Typically you have that primary zone. These are things that you use every hour, whether it's your keyboard, mouse, your phone, if you're writing. Those are things you want right close to you and that you're not reaching for. Then you have those maybe those things in your secondary work zone that you don't use that frequently, but still frequently throughout the day, but certainly not every hour. And so you want those maybe in that secondary zone where you're reaching a little bit for those. And then you have the reference zone. These are things that maybe you might reference, so maybe it's a manual or something once a day or twice a day or something. You put those a little bit further out, so again, you're not reaching for those that frequently. So look at this when you set up your workstation and try and keep those things that you use a lot in that primary zone. Let me just one other thing, let me go back to that. If you find, and I've seen this a lot at URS and PEHP, for example, if you find that you're not, for maybe for an hour or something, you're not going to use your keyboard, and your mouse is off to the side here, just push your keyboard to the left or right, however, whatever you are dominantly, your hand and whatever you use your mouse, and pull your mouse maybe to the center where your keyboard normally sits. That gives it a more neutral zone to you, and you're not reaching for that mouse so much. That's, again, if you're maybe not going to be using your keyboard as much as your mouse for a period of time. Let's integrate a little bit of that posture into the forces involved. Since all body parts have weight, the forces required to maintain a static posture can also contribute to some muscle strain. So, for example, if you don't use armrests, some people don't like armrests, but to keep your elbows at that good 90, 100 degree ergonomic or neutral position is going to cause your shoulders to probably hold those up a little bit. And over time, that's going to start to fatigue you a little bit. Another example here, I'll come back to that one. Let me skip to your head. Most people's heads weigh anywhere from 10 to 11, 12 pounds. If you're sitting straight, maintaining that natural curve to the spine, and you're sitting up straight and level, there's not much more than that 11, 12 pounds pressure on your spine. But every inch that we move forward, like this young lady here to the right, as she leans and doing some inspection work there, every inch we move forward adds 10 pounds of pressure on that spine. And so it's, again, think about what you're doing and what pressures you're causing maybe on that spine, your shoulders, your neck, and maintaining those positions very long. Really, you will start to fatigue. And so I'll go back to this slide here. Staying in that one position for too long decreases blood flow to your muscles. The oxygen doesn't get there like it should to your joints and your muscles, and so you start to fatigue a lot quicker. So, knowing that, one other thing before we get into kind of breaking up the monotony of maybe what you're doing. Contact stress. You can see here that picture off to the left. That is not a good situation. Anytime you're resting a wrist, a forearm, even elbows here, and you perhaps can cut circulation or flow to your wrists and hands, is not a good position to maintain. That's why a lot of times we might use a wrist rest, so-called. That's probably a little bit of a misnomer. We still shouldn't be resting a wrist on a cushion. It's best to maybe rest the meatier part of the palm or the hand on that as opposed to your wrist. So if you find yourself, especially on the edge of your desk or work surface, a situation like this, this is something we want to remedy really immediately, so you don't minimize the blood flow to your hands and wrists. Now, I mentioned static posture, so we want to break that up. Certainly taking micro breaks. Some suggest getting up, stretching, walking around at least every 2 hours. I think even every hour, and maybe even more frequently than that. Just to take, again, a little break from the monotony of keyboarding if you're doing a lot of keyboarding. Whether you sit up, stretch, or stand, you can do some stretches. I think my next slide here is just a little bit of, here's a poster here of some stretches you can do even when you're just sitting. But again, to get the blood flowing to those joints that typically aren't getting what they need when you maintain static positions. So make sure, let me just go back here real quick, that you're taking time to break this up. And maybe that is just, maybe it's job rotation. If you do a lot of keyboarding, but you can go and do some other work, whether that's writing or filing or something else, take time to kind of break up your workday and give you a break from just the monotony of that keyboarding and mouse work, if you have that luxury. If not, then you still need to get up and take those micro breaks and stretch and, like I say, get the blood flowing to those joints. And these little posters here, I know they have at HR, and this is something, if you need, we can get out to you as well, but just an idea of some things to do to, again, kind of keep you flexible and keep the blood flowing. Let's talk a little bit about repetition. You know, sometimes when motions are isolated and repeated frequently for prolonged periods of time, and a lot of times when you're using instruments like this, whether it's stapling, a hole punch, a mouse. I was at a legal office the other day. The young secretary was complaining about wrist pain, and I said, tell me what you do or show me what you do. And she took me back to the area where they were binding some legal papers, and one of these huge industrial staplers that, you know, have to go through maybe 50 or 80 pages. And so again, it was the perfect storm. She was doing this frequently. There was a lot of force involved with stapling and then pushing on the arm. She was flexing her wrist at almost a 90-degree angle. So of course she was having problems. So if you find yourself with some of these activities where it involves, again, a lot of force, frequency, and awkward positions, make sure you maybe look at some ways to again, alleviate this. For keyboarding, certainly there's keyboard shortcuts we can do so you alleviate having to use the mouse. Buying automatic or electric staplers and hole punchers. I know that's something that we've done at our office just to avoid having to go through maybe some of these awkward positions and repetitions to do this sort of thing. Certainly copiers can do that for you. And if nothing else, switch your hands off periodically throughout this activity so you're not just focusing maybe on doing it with just one hand or wrist. Just some ideas again to break up the repetition of some of these activities that you might have to be engaged in. Wanted to take just a minute to talk about, since this is a wellness webinar, some of the personal factors that can contribute to ergonomic issues. Certainly age and health, or overall health and wellness, our fitness, the hobbies we do, and maybe psychologically the stress we're under in our social environment. I'm going to share just one slide that this is one study of 3 studies that have been done, and these aren't real recent studies, but some of them have been done more recently. This is a study that was in 2007. But what it's showing is, in this case, it's just, we're focusing on some of the comorbidities that can exist with work comp injuries, whether that's hypertension or diabetes. In this case, they wanted to focus on obesity. And the study showed that and they're using BMI here. So for a normal BMI, which is 18 to 25, versus morbidly obese BMI, something greater than 40 here, the number of work comp claims was literally doubled in this test group. And then if you look at the lost work days per 100 full-time equivalents, from 14 for the normal BMI up to 184 almost, that's almost a 1,200% increase. Again, for the BMI of greater than 40, that's lost work days. I show that because a lot of this correlation between work comp injuries and just overall wellness is being much more documented and correlated. And I think just what we're doing here today, if nothing else, just giving you some good information about what we can do to address, in this case, ergonomics. But just keep in mind that our overall health and wellness has a lot to do with this. And so we're just kind of focusing on one leg here, the things that you do at your office, but your overall health and wellness are going to contribute to diagnosis of some of these MSDs. Just for example, women typically have 3 times the frequency rate of carpal tunnel syndrome than men, and there may be good reasons for that. Sometimes we find that the carpal tunnel itself ligament is just smaller in women. But a lot of times we have things like menopause or pregnancy, anything, even medications that might cause a water retention. And water retention tends to exacerbate these conditions of carpal tunnel syndrome. And so again, some of the issues, other health issues going on with in the workplace that or at home, like I say, our overall wellness that might contribute to some of these things. So personal factors, don't forget about those. Just briefly, because we're running short on time here, just some equipment. Your chair is going to be the most adjustable thing that you have. And so we want to make sure that our chairs fit us right and that we adjust them right. You can see in this picture here, there's no space between the kind of the pit of the knee and the chair. This chair pan is way too big for this person. You want at least 2 to 3 inches of space there, and while you're leaning back and supporting your low back. So that's where we start, is with chairs. And look at these things. If you have to adjust your chair to maintain that good 90 to 100 degree elbow height at your work surface, and if doing so brings your feet off the ground, then you want to get a footrest. You don't want your feet dangling off the ground as you work. Keyboards, they have all kinds of keyboards, some ergonomic. What you want to make sure is that this little graphic here up to the right corner, you keep your hands in that neutral and wrists in that neutral position, and keep your keyboard as flat as possible. Tuck the little legs down on those things and keep them flat to even a negative angle on your keyboards. Keyboard trays are nice to have if you have that option. I see a lot of people that use them, especially if you're set up on a corner of a desk here. You want to make sure that whatever you do, that your mouse, the keyboard tray, is big enough to accommodate your mouse as well with what you're set up. And as you hold your mouse, make sure you maintain that wrist in a good neutral position like we have here in the graphic. And on this one, again, the keyboard tray, that first picture off to the left, you see it move to the right there a little bit. That's where you want. You don't want to be reaching for your mouse all day. That's going to fatigue your shoulder and elbow, and keep that as close as possible to you and to your work surface and your keyboard. There are certainly alternatives for mice, and if that's something that you need to explore, there are some, like I say, options for that, even to have a mouse built into the keyboard like this lower right-hand corner here. But just be aware there are options with mice and keyboards if that's an issue. Monitor stands, whether you're work or home, even the center picture, like just using books is what I do at home, and you just, again, want to have the height of that monitor about level with your, or at least the top row of characters level with your eyesight. You don't want to be craning your neck up and down as you work throughout the day. And then telephones and headsets, if you do use a headphone or a telephone, headsets are certainly an option. And where we work, we just went through and replaced all the phones, and they're just a computer-based phone. You dial with your mouse and you speak through the combination speaker and microphone. So you don't even have to mess with the phone. But you want to avoid at the bottom there, putting your phone between your neck and your shoulder and holding it there. That tends to impinge on the muscles and nerves there. I don't know if we use document holders, but if you do, you want it in line with the screen and hopefully at the same distance as your screen, so you don't fatigue your eyes looking up and down or at different distances. Sit to stand desks. Let's just, we're about out of time here, but let's just say this. They're a good thing because they do break up the monotony of just sitting all day. You can sit and stand, and that's good to, again, be able to break up just sitting or just standing. But there may be some drawbacks. For people that have back injuries, I think they have worked out well. If you have knee or leg injuries, if you're standing a lot, that may exacerbate that condition. So that's something you'd probably want to bring up with your doctor. And they're not for everybody. It's just, I know it's kind of a fad right now, but I would say just consult with your HR department. And standing, like I say, is still a static posture, and so most Doctors recommend just starting out, maybe standing if you're going to use one of these, a half an hour today and for the first week, and then gradually building that up. But I would say bottom line is this. If you need one, consult with HR, your doctor, decide what will work best for you, your company, and the culture there. We are out of time. I didn't quite get through everything, but are there any questions that anybody had from what we've been talking about this afternoon? Let's see, we have some up here.
Okay, Raquel, I'm going to answer yours really quick. It says, does PEHP provide any kind of ergonomic assessment for our offices? You'll have to check with your HR on that. So each office would need to just check with their HR and find out what you have available to you. And then it looks like Chrissy asked, how do you handle 2 monitors? And I'll let Doug answer that.
We didn't quite get to maybe kind of doing a self-assessment here, but for example, if you have dual monitors, if you actually do use both monitors equally, then you should set up here like we are the top picture to the left with the keyboard and mouse center between the two. If you find that you're using one more than the other, then you can do like the bottom picture and kind of just slide one over. But typically, you're going to have to gauge that however often you use equally or not equally, and then go from there.
Okay, and then Kim, you asked about using a balance ball at your desk, and I know this is also an HR question to ask, but I'll also let Doug answer that as well if he thinks it's advisable. And then we'll go on and he can answer the one about the ergonomic keyboard as well.
So the ball, I like the balls, and I see people use them from time to time as just a break from the chair. I still like a good ergonomically fit chair that fits you, the seat pan, and the lumbar support, because you're not going to get lumbar support from the ball. But it is a good maybe alternative to switch around. But I doubt that most ergonomists I think I need to do ergonomists would recommend using a ball 8 hours a day sitting on it. And then we had one on keyboards.
An ergonomic keyboard.
So ergonomic keyboards, let me go back. I don't know that I had any pictures of them, but in general here, when you talk about an ergonomic keyboard, usually it's one that might be kind of split down the middle or angled such that you can maybe get a more neutral angle as you type. What you want to make sure is, one, your keyboard is flat, and then ergonomically, depends. If you feel like you need one, really, what I'd suggest is getting an ergonomic assessment just to see what you're doing. But on the self-assessment, you want to make sure your wrists are in that neutral position. So we talk about deviation of the wrist. If you deviate out to the outside, that's called ulnar deviation, and then to the inside toward your thumb is a radial deviation. And if you find that as you're set up with your chair that you're twisting your wrist either to the outside away from neutral or inside away from neutral, then maybe it's something we should look at as far as an ergonomic keyboard. But really, it starts with where you're set up from your armrest to your keyboard. Let's see.
So I know Doug brought, or in his slides, he has maybe a small...
I do have this self-assessment here. Now, this is something I'm going to have to provide you maybe as a printout, a PDF that you could look at if you wanted to do your own self-assessment, whether at work or at home. I think this is kind of a generic one, but I think a good one. I can provide this to Jody, and this is something maybe we can put out on the web or connect to this presentation so you could download it.
Yep, we can do that. So any other burning questions? We know we went over a tiny bit, but it's so good to have an expert here to ask and to talk about that. The slides are available if you just click up on Files, and then it will be archived under PEHP Wellness. You just need to look up under Webinars, and then you can print out anything you want from there, but we'll also have some attached as well. So we're so grateful that we had Doug here with us today and to share some insights on ergonomics. Thanks for joining us. There will be a little survey that you can take after, and we appreciate your feedback there. And if anyone needs any more information or your question wasn't answered, please reach out to healthyutah@pehp.org, and we will take care of you there. Thanks for being a member of PEHP Health and Benefits, and thanks for joining us today. Thanks, Doug.
Thank you.